All right, so just to kick things off with some introductions, my name is Elise Rudolph. I'm the Director of Online Recruitment and Admissions, specifically for our online MPH program. And I use she, her pronouns. And I'll pass it off to my awesome colleague, Derek, to introduce himself.
Hello, greetings, good afternoon, good evening, good morning, where depending on where you are coming from and zooming in from. My name is Derek Bynum. My pronouns are he and him, and I am the Director of Residential Admissions here for the Berkeley School of Public Health. And I will pass it off to my colleague, Stephanie.
Thank you so much and welcome everyone. I'm so excited that you're here. My name is Stephanie Nguyen. My pronouns are she, her. I'm the Online Education Recruitment Manager for the School of Public Health, specifically the online program. So I'm here to support you with any questions around that. But without further ado, I'm so excited to pass this along to my wonderful colleague, Lori.
Thank you, Steph. Hi, everyone. My name is Lori. I use the she, her pronouns. I have the distinct honor of serving as your in-residence admissions and recruitment coordinator. And we're so excited to have you here today.
Fabulous. So an overview of what we're going to cover in our formal presentation. We'll cover the mission, vision, and values of UC Berkeley School of Public Health. We want to share a little bit about who we are. We're going to cover the various concentrations that are offered across our online and in-person program options. We're going to cover admissions criteria, admissions timelines, everything you would need to apply to either the online or in residence programs. We'll talk about tuition, fees and funding, and then again, we'll have that Q&A portion at the end. All right, and I think Derek's going to kick us off with this slide.
Yes, so we always like to kind of start off any presentation or any information session you're kind of going over the mission, vision, and values here at UC Berkeley, because we think it's important for folks to not only know the nuts and bolts of, the programs or the application and admission requirements, but also we like to kind of go over these mission and values just to kind of give a better and deeper picture of what we as an institution strive for and believe and look for within our faculty, staff, and students here at Berkeley Public Health. And so first of our values is viewing health as a right. We do believe in social justice and that the basic human right of health and healthy life is, everyone deserves that. And so we definitely strive to make sure that we're working to minimize any inequities and injustices that might affect the health and dignity of people, especially for those that are most vulnerable within our communities. Okay, we look through strength. We look for it and aspire to the concept of strength through diversity. Oftentimes, homogeneity, having everything come from the same viewpoint or viewed through the same lens, doesn't really create a very strong society, and especially within healthcare. I think I'm a MBA fan, and so it says strength in numbers, and in that numbers, there's diversity, and in that diversity, we have varying viewpoints that we can use to help improve our community, especially within the context of public health. And so we're looking to make sure that we incorporate diversity into our programming and in the culture of our staff, faculty, and students here at Berkeley Public Health. We value thinking forward or forward thinking. We want to make sure that we are looking to the future and not getting bogged down by things that, how we've always done things or how things have always been done. We want to make sure that we're looking forward and kind of pushing the boundaries, pushing the envelope, and making sure that, we're, challenging conventional thinking and really leveraging things that we have at our disposal, like technology, research, policy, and really help build bridges within our communities. And last but not least, we want to make sure that impact first is something that our work produces. We want to make sure that we're demonstrating our commitment to having the maximum impact of our work by focusing on research, education, and above all, service within our areas and our communities that work to create more of a transformative impact on our populations, both locally and globally.
Awesome. And our mission at the School of Public Health is to improve population health, especially for the most vulnerable. Derek touched on this already, but we do this through radical collaboration. We want to meet the priority health needs and achieve health equity in our increasingly diverse communities. We also achieve our mission through preeminent education that challenges convention and develops diverse leaders who transform the health of our communities. And we do it through transformational research on major public health threats and opportunities that we're facing today and tomorrow. So this really is a vibrant community here at Berkeley Public Health. We are advancing this mission daily through the collaboration you see across students, staff, faculty, the new research that's emerging from our school. And we're UC Berkeley. This is going to be a top tier education, and we're really proud to deliver that in a variety of modalities.
Wonderful. I'm going to go ahead and dive into our residential program concentrations. So on your screen here, you will see the variety of our campus degrees that we offer for you prospective applicants that are interested in our programs here at Berkeley. Our most popular program, I would say, is our 2-year Masters of Public Health program. As you can see, we have a variety of concentrations that are available everything from epidemiology and biostatistics to health and social behavior, food, nutrition and population health, health policy and management, maternal child adolescent health, environmental health sciences. So a vast variety in the ways that you can approach public health and the degrees that you're looking into pursuing here at Berkeley. We also offer an 11-month Masters of Public Health. This program is designed for individuals who have some type of advanced degree already. This can look like a nursing degree or an MD or a law degree, and you're looking to add that little extra step in your educational experience by getting that 11-month degree accelerated program here at Berkeley. For individuals who are recipients of our undergrad BA in Public Health program, and you're looking to add a little +1 experience to your journey as well, you can take into consideration our 4+1 Masters of Public Health program in the 3 concentrations available, including EPI, food nutrition, and maternal child adolescent health. We also offer unique programs that are our concurrent degree programs, and these are partnerships that we have with other schools through UC Berkeley. So public policy, journalism, city planning, social welfare, and our business program. So this gives you a unique opportunity to earn 2 master's degrees in 3 years. Traditionally, master's programs are about 2 years, so you get 2 degrees in 3 years instead of the 4 years. One in an MPH and one in a partnership school, whether that's an MPP or an MSW, whichever of our partnership programs that we have available. We also offer an MA or an MS program, including our biostatistics, EPI, environmental health, and global health. And last but not least, our joint programs. One of our most popular programs as well that we offer here is our joint medical program, or JMP program. And this is a unique partnership that we have with UCSF, which is right across the bridge from us here in the Bay Area. And this gives you an opportunity to do an MS here with the Berkeley School of Public Health, as well as a medical degree over at UCSF. So vast variety of opportunities available here with our programs. And I'm going to go ahead and turn things over to Stephanie to talk about our online.
Thank you so much. So with our program, we have a different modality, which is 90% online and 10% in person. We'll get into that in just a few, but we offer 4 specific concentrations for mid-career professionals, working professionals, that want to come to campus but cannot. This is the program that's going to have very specific skill sets that tie to the interdisciplinary concentration. Within that, we host some tracks. So if you're interested in community health sciences, spatial data sciences, or even global health, it's a really great avenue to consider. If you're interested in health policy and management, we also have a health certificate that is tied to that. So for health policy and management students in our online space, if you're already going through that route, there's an opportunity for you to obtain a health management certificate on top of your MPH degree. So it feels like a 2-in-1, which is really nice. We also have a concentration around epidemiology and biostatistics and food nutrition and population health. The last thing I should mention with this is if you don't see a specific concentration that is specifically outlined here, in some cases, we may be able to work with you through the interdisciplinary concentration to support you with that, specifically speaking on maternal, child, adolescent health, environmental health sciences. And last but not least, our online students are able to take 2 in-person public health courses while still being an online student. And with that said, I will get into the program design. So our program degree is a professional degree. Students that are obtaining an MPH through our online program are utilizing these skill sets to strengthen their skills and add to their public health training through professional curriculum. And with that, the duration of our program is 27 months. So it's a 7-semester program. The units for graduation for our program is 42 units to graduate. The modality of instruction is 90% online. It's taught asynchronously, meaning that you don't have to log in at a specific time to complete your work. This is on your own time. But there are given deadlines within that asynchronous space, and also opportunities for live engagement depending on what classes you're taking. Our program also has a 10% requirement in person. So this is 2 mandatory summer campus visits where you'll be on site here at the School of Public Health for 4 to 5 consecutive days for that annual summer campus visit. The weekly commitment that you would spend within our online space is probably about 15 to 17 hours on average per week on your course assignments. And the practicum. Yes, our program does require a practicum, and we are so excited for this component because this offers you as working professionals who may not be here at the School of Public Health to still gain your field and advance your skill sets through a practicum that might be where you're at. So you're really able to maximize education in place. And this is about a minimum of 130 hours with an average duration of about 3 to 4 months. I'm going to pass this back to the residential admissions team to talk a little bit more about the timeline and requirements.
Awesome. Thank you, Stephanie. So in relation to our residential admissions timelines, excuse me. In terms of, let's see if we can, hold on. Oh, I don't know why I can't move it. Oh, thank you. Whoever advanced the slides, thank you. For whatever reason, I can't do it right now. But anyway, we move forward. For our residential admissions requirements, here is a list of all the application and admissions requirements and materials that you will need as a applicant to our MPH, our residential MPH programs. Okay, so for as you'll see on the left-hand column, we have a checklist of all the requirements for applicants with a U.S. or English Canadian bachelor's degree, which includes obviously the SOFAS application and application fee. Okay, there is the UC Berkeley grad application fee, grad application and fee. Now, just to kind of provide a little bit more details. So if you are an applicant to our MPH programs or our, I believe, DRPH program, you will need to complete the SOFAS application, okay? This is just part 1. After you've completed your SOFAS application, after you've included and uploaded and submitted all application requirements and paid the fee, you will be given, excuse me, you'll be sent information, specific information on how to access your UC Berkeley graduate application. Now, some of you might be thinking, oh my God, so I'm gonna have to do 2 applications. Not quite. We want to make sure that we're making it, not so difficult for you as an applicant. And so once you have completed your SOFAS application and paid your fee, you'll be sent the information to your UC Berkeley grad app. And you will not need to do 2 applications. You will not need to complete 2 applications because all of your information and your application materials that you submit to SOFAS will automatically be relayed to your UC Berkeley graduate application. Okay, so we wanted to make it a little bit easier for you, and making sure that you're not having to do double work. Okay, but just make sure to keep note that you will need to submit and pay both your SOFAS application and your UC Berkeley grad application, because we will not be able, unfortunately, we will not be able to review applications that have not been paid or had an approved fee waiver. Okay. In addition to your application and fees, you'll want to and need to make sure that you submit any and all relevant resumes or CVs. I know sometimes we get questions about, which is which, or which one does your admissions department prefer, or which ones do your admissions committee reviewers like to see? Really, it kind of just depends on what you have. Some folks are more rooted and have more experience within higher education and done things such as research or scholarly articles and periodicals, or I should say scholarly writings and articles and writing samples. Some people, after they've completed their undergrad or their further graduate studies, they're working in the field and they have employment, maybe not research, but just employment. And so typically you're going to see any employment that you have that might not be research related, that will be on your resume. But if you have research related employment, that'll typically be captured on your CV. Okay. In addition to this, you'll also need to make sure that you have included your 2 required writing samples, which are your statement of purpose and your personal history statement. Real quick, just to kind of delineate the two. Statement of purpose is more of an official writing sample noting, what your goals are, how this program that you're applying to aligns with those goals, and how that's going to help you, how you align with the program, and how it's going to help you get to your goals within your studies and your career. Your personal history statement, on the other hand, definitely dives more into your personal story as an individual going through your educational and employment journey, and really kind of taking the time and the opportunity for you to kind of paint the picture and provide a little bit more insight to some of the hardships and levels of adversity that you've encountered on your journey. And so that's kind of like the differentiating factor between applicants, because many applicants can have the same coursework, same GPA, but like I always say, no one has the same story. No one has your story. So that's kind of the difference between the statement of purpose and the personal history statement, because we sometimes get questions on what's the difference between the two. Okay. In addition to that, you'll need a minimum of 3 letters of recommendation. At least I like to tell folks, the minimum is just the minimum. The minimum is just the floor. You always want to try to do a little bit above the minimum. So if you can get 3 letters of recommendation, 3 solid positive letters of recommendation, great. I always advise people try to get 4 if you can, just because 1, it's always good to just have that 4th one, just maybe in case one of your 3, something happens, maybe they're indisposed, or, they go off on vacation, or they have things going on, or they forget. Sometimes it happens. So, if you're including 4 letters of recommendation, then you're definitely going to get that 3 minimum. The maximum that we will read is 5. Okay. So, and sometimes depends on the how busy and how slammed the admissions committee is. They will for sure read 3. They're not going to read any more than 5. So 5 is your maximum. Okay. So I will always say split the difference and try to send us 3 to 4 letters of recommendation, positive and solid. You'll need to make sure all your transcripts from all institutions you attended are included in your application. Yes, that I do mean all. I once had somebody ask me if they need to include the transcripts from a community college that they attended once, in which they only took archery in the summertime. And yes, you would need to include that transcript with, seemingly irrelevant coursework like archery or weightlifting or, wood shop. You need to make sure that you submit all transcripts from all colleges you've attended. Okay. The official GRE test score is not required for all programs. Some specific programs do require it, but most don't. Most programs, the GRE is optional. We also get the question of, well, if it's optional and I've taken it, should I include it? That's completely up to you. But again, I always say, if you've taken the GRE because other schools of public health do require it, and you got a good score, then it won't hurt to include it in your application. Okay. And last but not least, there are a handful of programs that do require a writing sample. Most programs do not necessarily require a writing sample, but if so, you will want to make sure that you include it. And those, we'll go over it. I'm sure we'll cover that more in detail later, but those include scholarly journals, research, theses, or your senior or final thesis statement, anything where you're, completing and submitting an official writing sample to a formal entity or through a formal entity, that will suffice as a writing sample. And then I wanted to also include the checklist for applicants who might not have a U.S. or English Canadian bachelor's degree. Maybe you received your bachelor's degree from outside the U.S. You'll also need to make sure that you include, if this is the case for you, you'll want to make sure that you include the WES evaluation of any and all international transcripts. And you want to make sure that they're sent to SOFAS. And I want to make a note, you want to have those WES evaluations with a course-by-course evaluation, okay? You'll also need to make sure that you include any and all transcripts or degrees from each institution that you attended outside the US, as well as your official TOEFL or IELTS scores. But those TOEFL or IELTS scores are only required if applicable to the country in which you were granted your degree.
Great. So I'm going to go over the admissions process now for our online MPH program. So if you're interested in potentially applying to our online program, first, I do want to share that UC Berkeley only allows you to have one application open at a time, regardless of the program. So you will have to think through if you're wanting to apply for the residential, one of the residential programs or the online program first. However, if you choose to apply for the online program, it's just one application it's the UC Berkeley Grad app. So you do not need to complete SOFAS if you're doing the online MPH program. And to sort of kick things off, there's a few prerequisites that we're looking for. And we can talk more about, there's some nuance here. We want to provide some flexibility and space, but generally what we're looking for as prerequisites for our online MPH program is that we do want to see that you have a bachelor's degree or a recognized equivalent from an accredited institution. We do want to ensure that you have some quantitative experience because our first year courses, the classes you take in your first semester in the program are fairly rigorous on the quantitative side. Even if you're not doing epidemiology, there's these intro courses that do have kind of a heavy quant focus. And so we want to ensure that you have some familiarity with statistics or college level math. It can also be that quantitative prep can also be demonstrated through biosciences, social sciences, or kind of a combination of coursework that give you some quantitative experience. And then lastly, we do like to see that you have a 3.0 or higher for your advanced GPA. And that's actually a UC Berkeley standard. It's not specific to our program. And we do offer some flexibility around that. So if you're not meeting that 3.0, don't count yourself out. We would love to meet with you and talk with you more about how to put your best foot forward in the application process. So getting into kind of the specific requirements, again, there's no SOFAS application required, but we do still have an application fee for the UC Berkeley Grad app. That's $135 for our domestic students, $155 for our international students. We need to see some of your work experience. We are a professional program, as Stephanie mentioned earlier. We really like to see that applicants to our program have around 2 years of prior work experience. And so you can show us that through a CV or a resume. We also require the same 2 essays, your statement of purpose and your personal history statement. We'll talk a little bit more about those in a moment, and Derek also sort of touched on those. Again, we require that minimum of 3 letters of recommendation, and we do need to see transcripts from every institution that you've attended. So if you did some community college coursework before attending a 4-year, if you transferred schools, if you did a study abroad semester, we do need to see transcripts, they don't have to be official, but we do need to see transcripts from every institution that you attended. So please do submit those with your application. We do not require GREs. Yay, that's great. So if you haven't taken the GRE, you don't have to. But if you have taken it and you feel really satisfied with your score, you are welcome to submit that as part of your application. If you're an international student or you attended your undergraduate, if you completed your undergraduate degree in a country where English was not the primary language, we may ask you to submit proof of English language proficiency through either the TOEFL or IELTS exams. And you're welcome to submit your WES evaluation for international transcripts as well, or any, and also you would likely need to submit degree certificates if you completed your degree internationally. So in addition to your transcripts, we would want to see like a copy of your diploma. So those are some additional pieces that would be required if you're an international applicant. Yeah, and I'll pass it back to Derek to talk about the residential admissions timeline.
Thanks, Elise. So this is, an area of interest for most prospective students, especially if maybe you're kind of making the decision to apply to a program, relatively recently, and you're wondering, okay, what's my next 2.5 months or 3 months going to look like within the context of, starting an application, getting all my materials and sending it in. Hopefully not at the last minute. So just to kind of highlight, what that timeline looks like chronologically. So the SOFAS application is open. It's been open for about 2 months now, since mid-August. Okay, so if you're thinking about applying to the program, you'll want to make sure that you start your application in SOFAS first and sooner rather than later. The UC Berkeley grad application has opened for all programs. It's been about a little over a month now. We opened in mid-September. Okay, so both your SOFAS and UC Berkeley grad applications are open for those that need to complete and submit both. Again, just wanted to reiterate, you want to make sure that you complete and submit your SOFAS application first. Okay, I always tell folks the sooner the better. There's no need to, we still have about 6 weeks until the application is due. So if you have not started, I highly, highly recommend that you start today, like yesterday. Okay, because the reason why is because not to, cramp your calendar, because I'm sure you're all very busy individuals, but the reality is a lot of, or for some people, it takes time to get some of these documents. It takes time to get some of these materials. I'm going to probably direct that statement specifically, not exclusively, but specifically to international applicants, because you will probably need to obtain your WES evaluations and sometimes translations for WES evaluations and your language efficiency tests if you haven't done so already. And sometimes you might need a translation of your transcript. And sometimes that can take anywhere from, I think for me, I've seen the average, the soonest is like 4 weeks, 3 weeks, 4 weeks. The average is about 6 weeks. Sometimes it can take up to 2 months or more, depending on the situation. So given that we're at the end of October, like I said before, if you haven't started your application yet, you want to start it like yesterday, because even if we're just talking to domestic students, sometimes transcripts can take a long time. Longer than we expect. Sometimes, and many times, letters of recommendation take longer than we would like. Even though your the deadline is going to be December 2nd, which is my next point, your priority application deadline for both for summer 2025 and fall 2025 is December 2nd. So therefore, especially if you're reaching out to people for your letters of recommendation, sometimes letters of recommendation don't get sent as quickly as we would expect or hope. Okay. And so, first of all, I would recommend that there's actually a function in the SOFAST application where you can provide your own deadline to your references. And even though our deadline is December 2nd, you can, put the deadline in SOFAST maybe a week or two sooner than that December 2nd deadline, which actually would probably be a good idea just to make sure you get those letters in a timely manner. Okay. But I just want everybody, if you haven't done so, circle December 2nd, 2024, it's a Monday, as the day on your calendar to make sure that you get everything in. And I want to highlight that 8:59 p.m. Pacific time is the cutoff. Okay. That's going to be 11:59 p.m. Eastern time for those on the East Coast. Okay. After you submitted your application, after you have that big sigh of relief, at least temporary relief, you'll want to make sure that you are following up in your application. Make sure that you submit the most up-to-date and an email address that we can reach you the most, because sometimes we might contact you for any missing materials. Okay. But after that, after December 2nd, that's when we start reviewing applications. Okay. And that happens for typically, realistically, we start after the deadline, but in reality, there's, that whole winter holiday break for everywhere. And so the bulk of the reviews happen in the new year, right around the start of January. And we typically tell students or tell applicants to expect to receive their decisions regarding their admission to the program around mid to late February is when students can typically expect their admission decisions to be sent out to them. Now, for certain programs, such as the interdisciplinary 11-month and the FNPH 11-month and 2-year MPH, there is a second application deadline. Okay, and that this year will be March 3rd. So you'll want to, for those people who are applying to these specific programs, you'll want to circle December 2nd and then March 3rd. Everybody else, it's just December 2nd. Okay. And like I said, right around late February is when we start sending out decisions, or I should say when our admissions committee finalizes decisions and applicants receive those admissions decisions from their program. Okay, so it's kind of it's a process, but I think sharing this timeline kind of creates a little bit more of a calming effect for people, so they kind of know what to expect before, during, and after they submit their applications.
One thing I do want to clarify before I move on to the online MPH admissions timeline, that December 2nd priority deadline is for all programs. So
yes,
if you're interested in the interdisciplinary program or the food nutrition population health program, the for best chance of admissions, of gaining admissions, you do want to submit it by that December 2nd deadline, as well as if you're want to be considered for financial aid or funding.
yes.
So
yes.
that's something to keep in mind. If you happen to miss the December 2nd deadline and you are interested in the food nutrition population health program or the interdisciplinary program, that's your second chance opportunity to get your application in by March 3rd. So I just want to make it clear that if were best chances of gaining admission and funding, it is important to apply for that by that priority deadline. They're just a second chance opportunity in case you missed the deadline for those two specific programs of March 3rd. So I just wanted to make that clear.
Thank you, Lori. And this is the kind of detailed, nuanced information that you kind of sometimes only get from these information sessions. And so that's the reason why you guys are here. So thank you again, Lori. Yes, all in all, bottom line, December 2nd is the date that you want to really pay attention to.
All right. So like the residential admissions programs, we do have an application that's currently open for the fall. However, we have a slightly later timeline. So again, you don't have to do SOFAST for us. It's just the UC Berkeley grad application, which is already open. You're welcome to start your application anytime. And then we have two deadlines to keep in mind. Our priority deadline, our earliest deadline, is January 5th. So you can work on it over the holidays if you'd like, and get it in the new year. And then if you aren't, if you think you might not make it by that January 5th deadline, we have a final deadline of March 2nd. So March 2nd is our hard line in the sand. That's the last day that you can get your entire application in. So do mark that on your calendars for the online program. And then if you apply by the priority deadline, so January 5th, you can expect to hear back from us in mid-March, mid to late March. If you apply by that final deadline, March 2nd, you can expect to hear from us probably end of May. So you will hear back earlier if you apply by our priority deadline. All right, and I'm gonna hand it off to Derek again.
Thanks, Elise. So in order, one of the questions, I'd say the number two question, the number two most frequent question that we get behind the number one question is, or I should say the number one question that we usually get is a student will kind of like send us all their information, their life story, their transcripts, and say, what chance do I have of getting into the program? Unfortunately, we can never, ever answer that question. So that's the number one question that the most frequent question that we get. The number two question that we get is a little bit more focused and actually a much more answerable question on our part, which is, how do I make myself, a strong applicant? Okay. So there's just a couple of steps to doing this, to making yourself a strong applicant. One, you want to make sure that you visit and take note of all admission requirements, just to make sure that you are checking off the boxes for all basic admission and program-specific qualifications. That's number one. It's kind of like, going on a trip. You can't get to where you're going if you don't know. You can get on the road and drive, but if you don't have a destination and you don't have the directions to get there, then I don't know what chances you have of actually getting to where you're trying to go. So you want to make sure that you have all the materials and all the requirements that they're known to you, and that you have them ready to go when you submit your application, or before you even start your application, so you know exactly what you're working towards. Two, you want to make sure that you review carefully the application instructions. I've worked in admissions for quite a while, and I can't tell you how many times I've reviewed applications from strong applicants that did not follow the directions on the application. And so you want to make sure that you are carefully reading and paying attention to all application instructions, just to make sure that you have all the materials, because sometimes there's supplemental items or materials that are asked. And if we, or I should say the collective, we're not paying attention to those, we can miss out on a great opportunity just by one small oversight. So just make sure that you are paying close attention to the application instructions on your specific application. Okay. Like I mentioned before, start your application early. Do not wait until Thanksgiving to start your application. If anything, you want to be submitting your application by Thanksgiving, to be quite honest. If you are submitting your application by the second or third week of November, you're in good shape. That's not to say that you can't submit it after that. I want to make it clear, but the earlier you start your application process, the better, because there's a higher chance that you're going to get all the required materials in by or before the deadline. And I can't tell you how much missing materials hold up an application's review and might impact negatively an applicant's chances of admission. So start your application early and try to get your applications in by the priority deadline. Okay. Last but not least, you want to make sure that you use the financial aid page to calculate your tuition and your cost of living, and also to see if there's any funding opportunities for you. I always kind of look at applying to a program as a kind of not two-step, but it's a kind of a two-part process. You want to actually have all your materials and your application ready to submit on time. And then afterwards, you got to think about how you're going to pay for your program. Okay. And so you want to make sure that you are visiting the financial aid page to look at any and all financial aid opportunities and funding and fellowship and scholarship opportunities as well.
Thank you. And if you are planning to apply to the online program, thank you first and foremost. And similarly to what Derek had mentioned, we have a pretty similar step if you're just kind of on the cusp of deciding. So the most important thing I would actually recommend when it comes to visiting our admissions requirements is also booking an appointment with me. It might be nice to just kind of get a little bit of a deeper dive into what the program looks like, and maybe get that confirmation that this is the area that you want to go, and we're here to support you with that. Two, definitely reading the application instructions to ensure that you have all the materials that you need to successfully apply to the online MPH program. Three, you want to ensure that you've selected the right concentration and the program. It's always important to ensure that your application materials align with the program that you're applying to. So really think about that. And again, we are here to support you if you have any questions around that. And starting early is always helpful, but we also know that, things come up, and even if you're at the tail end of that deadline, try your best, come talk to us, and we can come up with a game plan together to ensure that you can still submit a strong application that feels very tailored to your skill sets and your goals. And last but not least, reviewing the fees and funding page. So with us, we have very limited scholarships, which we'll get into in just a bit. But it's also a great time to do your calculations, see what the projected costs will look like. If you have to apply to FAFSA, you can start your application then. And with that said, we'll get into the next steps around the GRE.
Thank you, Steph. This is a common question that we get asked is, will I be at a disadvantage if I don't submit a GRE test score? I want to reiterate, GRE is optional. This is completely up to you. It is your choice whether or not you would like to A, take the GRE, and B, submit the GRE test score. This is an opportunity that I like to just share with students, and like the GRE just provides an additional glimpse into your quantitative, verbal, and analytical abilities in a different format. But there are multiple ways in which that you can demonstrate those abilities as well, including if you've conducted any type of research or evaluation that can demonstrate your abilities to do quantitative analysis, any good grades that you may have earned in epidemiology courses or biostatistic coursework, experience working with statistical software such as R code. Additionally, of course, good grades in math and statistics classes, published paperwork or other evidence of strong writing that you may have. And I just want to notate that on your application, there is an other material section if you want to include writing samples or any evidence that you believe you can't demonstrate in another area of your application. There's always that option to include those type of materials there as well. And of course, you can always also demonstrate that if you've taken, let's say you've been out of your undergrad experience for a little while, you've been working, if you want to take an extension class, either through Berkeley Extension or another UC campus, that's a great way to demonstrate those skills as well. Even community college classes. So an intro to statistics class that will demonstrate to the admissions committee that you are taking active steps to prepare for this program of interest. Again, this is a professional degree program, and we do look at things holistically. That is something super important to keep in mind as you're preparing your application, that we look at everything: statement of purpose, academic history, transcripts, everything that encompasses your application. You are not just your grades. You are not just one element of your application. You are a whole human being, a whole person applying to this program, and we do look at everything holistically. But this is just here as something if you would like to include it in your application. Letters of recommendation. Part of that holistic review process are those letters of recommendation. As mentioned, both programs do require 3 letters of recommendation. This can be a combination of academic and professional references, all just depending on, of course, your years of work experience. And these letters of recommendation, oftentimes when students hear or applicants hear academic, they automatically think a professor. academic reference can also look like a scholarship advisor, a transfer counselor, anyone who has been influential or has worked closely with you throughout your academic journey. This can also include a TA or a GSI here at Berkeley, as we call them, graduate student instructors. And they can co-write these letters with your professor. You want to ensure that there is both signatures on those letters of recommendation, just to showcase honestly the way in which you build partnership and community. These letters of recommendation provide us a glimpse of that through a different perspective outside of your own, which you would demonstrate, of course, through your statement of purpose and personal history statement. So I just want to let you all know that this is a great opportunity to do that. And some best practices: sending your references a copy of your resume or CV, copies of your essay, information about the program in which you're applying to is always great as well, and a few key details that you would want them to address in those letters of recommendation for the program of your interest.
So with the resume or CV, it's best to use whatever you would use for your employers. Our tips for this are to keep it updated and include all the key pieces that you see here. So educational degrees, employment experiences, volunteer experiences, etc. This can be a key pointer in terms of what a holistic review uses. So if we're reading your essays, we'd love to see your resume or CV so we can kind of see a deeper dive of the work that you've produced throughout the years and how it either is aligned with the work that you're working on, the goals that you're seeking out for yourself, or maybe if you're making a pivot, how does this all transfer into the MPH degree?
All right, so we've talked a little bit about the two different essays that you would submit for either our residential programs or our online program. But we wanted to go into a bit more detail so that you feel prepared and ready to submit these two essays or write them. So the personal history statement, the way I like to describe this is you're telling your story, your personal story. Derek kind of touched on that. But it's really important to keep in mind your audience, like with any piece of writing that you do. So, at the end of the day, your audience is going to be an admissions committee. So typically it's faculty here at UC Berkeley. And you want to ensure that as you're telling your unique personal story, that you're tying your storytelling into how these experiences have prepared you or motivated you to go into the field of public health. So how have your personal life experiences uniquely prepared you or positioned you to be in the public health field? How have these experiences maybe sparked your interest in public health or motivated you to pursue a specific topic or concentration within the field of public health? So we want to hear about you. We want to hear who you are, learn about you, but also it's so important to ensure that you're really tying in your journey to why you're applying to this degree here and now. And your statement of purpose, this is going to be even more directly related to why you're applying to this degree. So your statement of purpose is really I think one way to think about this is you're telling the admissions committee, why this degree, why now, why UC Berkeley, why public health. You want to answer, the admissions committee should be able to read your essay and understand all of those things about you when they have read your essay. So you might want to describe the particular public health challenges you're passionate about, how you would like to address those challenges. You should describe how UC Berkeley's program or the concentration that you're applying for will help you gain the knowledge that you need to make the impact that you want to make. And you should demonstrate alignment with the program or concentration through your existing strengths. So again, throughout the statement of purpose, you really want to make it clear to the admissions committee that this is the right next step to get you to where you want to go. So that's sort of the framework. There's a little more detail on these slides that you're welcome to review when we send that out. There's also some great resources on our website and through the Dream Office, which is another resource that we have available. So I highly encourage all of you to sort of explore the resources on our website that can also support you writing these 2 essays. All right, I'll pass it back to Lori.
Wonderful, thank you. So one of the elements that we require, or some of our programs require rather, is a writing sample. For the majority of our programs, it is optional, but some of our program degree options for our residential programs do require a writing sample, including our environmental health sciences, global health and environment, health and social behavior, and our interdisciplinary Masters of Public Health programs, specifically in this case for our admission session here today. So a writing sample can include a final paper from a class that you've completed, a popular media article that you may have written, an undergraduate thesis that you may have completed, publication, some type of paper that you were either the primary author on or the sole author on. This just provides the admissions committee an additional level of understanding your writing, whether it's academic, and just to provide that context around some of our programs. For example, our health and social behavior program, there's a lot of communication, writing that is involved with that program, similar to a lot of the research work that you'll be doing across the MPH program in general. But this is just an opportunity to show those elements of what you do or how you write, essentially, and highlights your writing and analytical skills, essentially. So just wanted to be sure to highlight that here for you all today. So tuition and program fees and funding, let's go ahead and dive right in. So residential tuition, this is a breakdown of our 11-month, 2-year, and 11-month MPH, 2-year MPH, and our 2-year MS and MA programs. So one thing that I want to clarify very quickly is the difference between a professional degree and an academic degree. A Master's of Public Health, whether residential or online, is considered a professional degree. With our professional degree programs, for our residential program specifically, there is what is called a PDST, or a professional degree supplemental tuition for our residential students. So as you can see here, our 2-year MPH program for our California or residential students, $66,311 for the full 2-year program, and then $90,801 for our non-residents for the full 2-year program. For our academic program of an MS or an MA degree, this cost does not include that PDST cost, and it was about $45,247 for our California residents and about $75,451 for our non-residents. Our 11-month program, 11-month MPH program is half that cost of the 2-year MPH program, with the addition of, because it is a summer start program, you will have to pay for the summer classes as well, which is all included in this tuition and fees that you see here. Just one thing, this is an estimated cost, current cost. It is subject to change. Just want to let you all know, but this is the current estimate based on the academic fee schedule, or the fee schedule that was published by our registrar's office here at Berkeley. So you may be wondering, Lori, sounds like a lot of money. How am I going to cover this cost? Do not worry. There are multiple ways in which that you can fund your tuition as a graduate student. If you are eligible to, filling out and completing your FAFSA to be considered for federal loans. Additionally, if you are eligible for it, filling out a DREAM Act as well and completing your DREAM Act application. We do offer both merit and need-based fellowship opportunities here through our school public health residential program. There are also training grant opportunities, off-campus jobs and internships. We are located right here in the heart of downtown Berkeley. So there are many opportunities in which you can work right here in Berkeley or in the surrounding areas. And of course, do not discount those external funding opportunities. That $500 scholarship, that $1,000 scholarship, apply for them. They will all add up and contribute to your tuition and fees that you will have to pay for our programs. One of the fellowships that we offer here that I do want to highlight is our Blue Shield of California scholarships, which provides tuition awards that range between $10,000 to $30,000 for each recipient. We have this cohort of students is involved also in professional development opportunities such as including Dean Speaker Series, Career Cafe, and employer information sessions, as well as you'll have the opportunity to have visits from public health organizations, mentorships, and internships. And this is all on top of the resources that you will get as a student, a traditional residential MPH student who may not be a Blue Shield California Fellowship recipient. One thing I want to emphasize, we do not have a separate funding application. There are funding questions that are highlighted in your SOFA's application, your initial admissions application. It is going to be super, super, duper, duper important with the cherry on top that you take your time to answer those funding questions to the best of your ability. Okay, so slow down, read the application, leave it alone, come back to it, review it, make sure all is good, and turn it in when it comes to that. So we do not have a separate funding application. It's all encompassed in your initial application to us.
Great. And for the online MPH program, our fee structure is slightly different. You will pay per unit, per enrolled unit. So our current fee rate is $1,552 per unit, and our total program is 42 units. And you only are paying for the units that you're currently enrolled in. So typically our students are enrolled in around 6 units a semester. So you're paying that $1,552 per unit just for the number of units you're enrolled in a given semester. And there are a couple of additional fees. We have the Berkeley campus fee, which some folks ask, why is there a Berkeley campus fee if I'm an online student? And so I always like to share that first and foremost, you are a UC Berkeley student, even if you're doing an online modality. And so there's a ton of campus resources you have access to, even as an online student. There's all of our library resources. There's online counseling services. There's, even things like free workout classes you can do online. So there's a ton of campus resources that you can take advantage of as an online student. There's the student health insurance plan or SHIP, and you do have the option to waive this fee if you already have insurance through an employer or another means. There's the document management fee, and there's our instructional resilience and enhancement fee. And that's a small fee that is just added so that we can be continually updating our online content, our online modules, making sure that it's super accessible, engaging, and that we're delivering the top tier online experience for our students. So we have a whole team that are continually making sure that that your online instruction experience is really beautiful and seamless. So that brings the total cost of our online program to just under $70,000 for the 27 months. Yeah, and there's a number of ways that our students do fund their program. So because this is a part-time program, a lot of our students are employed full-time. I would say the majority of our students are employed full-time while they're doing the program. So the self-funded route is something that some of our students will do. They'll pay for the program out of pocket while they're completing it. And there's other things that can help with that, like the fee payment plan, which breaks the fee payments into smaller monthly installments. There's also federal student aid available. Highly encourage everyone to complete their FAFSA, even if you aren't sure if you want to use federal financial aid. It's just a great thing to do. And FAFSA is your free application for federal student aid. Employer sponsorship. This is something we highly encourage everyone to explore. There are a number of employers that offer tuition benefits as part of their benefits package, or you can even approach your employer sometimes to see if they would contribute toward your degree. We have a list of external funding sources that we also have available on our website where you can explore things like ASPPH fellowships and things like that. We also have a number of students who take advantage of public service loan forgiveness. So that would be if you are employed by a government or a nonprofit agency while you're in the program, you can actually have the public service you can actually participate in a public service loan forgiveness program while you're in the program paying tuition, which is really great. While you're in our program paying tuition. And then we do have a couple internal scholarships. We have the Dean's Health Equity and Leadership Award, which is around $10,000. And this is offered to 3 students every semester. It's available every term to 3 different students. And then we also have the Rural Health Innovation Program, which is a fully funded scholarship for folks who are both living and working in rural communities. And that's available during the spring 2026 term.
So as we get closer to the end of this information session, there's many ways to contact us. So you can reach out to the residential team through sbhadmin@berkeley.edu. You can reach out to us, the online admissions team, at online.mph@berkeley.edu as well. So many ways to get in contact with us, but I'm going to stop the recording so we can get to the Q&A portion. You can utilize this space to unmute yourself, use a hand raise feature if you prefer, or use the chat. But thank you so much for making the time to connect with us for this information session. We really appreciate you sticking the whole way through.
Yes, thank you, everyone.